Hi guys, and welcome to episode 26 of Notable Needlework. I am Kate Notable Needle, Noteable, on Ravelry, on Plurk, and on Twitter. The blog, if you're watching this on iTunes, is at notableneedlework.blogspot.com. And this is take 2 or 3. My husband came in the middle of my first time through and informed me that the timer in the kitchen was going off, and he couldn't figure out why. So I came back, finished recording, and iMovie was fighting with me about uploading the files onto Blip, so I'm just re-recording. It's been a fun week. Just a lot of classes, labs, all that fun stuff. I have one finished object, which I am completely and utterly in love with. This is my Stethoscope Cozy in Shibui Knits sock yarn, in the Zinnias or 51305 colorway. And I love how it turned out. I had a big fight with it last night when I was finishing it up because I could not get the head of my stethoscope off to put it on easily. So I just fought with it, and I actually have blisters on my fingers now from scrunching it over the bell the entire length of the cozy. Would not recommend that at all. I think it has been stretched enough so that it should be easier to take on and off now. So I would do it again. I would probably take the recommendation of doing the entire thing in ribbing instead of stockinette so that it can actually stretch over the bell and the diaphragm easier. So yeah, I love it. I sort of spent my energy in the first recording of this, so I'm trying to get it back. But yeah, that is my one finished object, and I love it, and I love my stethoscope, so it works out nicely. Works in progress. I have my Camp Loopy shawl, which I keep thinking about ripping out the entire thing and just doing a stockinette shawl, like, just because I have taken my skein of lace weight since it was like 1,400 yards, and I divided it into an 800 yard skein and then a 640 yard skein. Seriously considering just ripping it out, doing a stockinette shawl until I use up this entire ball of 800 yards, and then adding a lace border on the end. I haven't entirely decided whether or not I'm going to do that, because this is really, really pretty. It's the Firebird shawl, which I will link to in the show notes. And it's pretty, and it really should be an easy lace pattern to memorize, but it really just hasn't been. And a lot of the time that I like to knit is, you know, in between classes or while we're waiting for the lab to open or whatever. And doing things with a chart just is not that easy. I finished the second repeat of Chart B. I'm either doing somewhere between 4 and 6 repeats if I continue on with it. I don't know, I'm just so torn because, yes, I don't have to finish the shawl until September 15th, but really I have to finish it before that because the Plurk Podcaster Challenge starts on the 2nd. And there's no way I'm going to get this done if I have the Plurk Podcaster Challenge one project at the same time. It's just not going to happen. So I'm very torn and would appreciate your suggestions, because it would create a nice fabric if it was just stockinette. So I'm not completely against that. My husband and I were having a discussion about whether or not it's in the spirit to do that. I'm trying not to lose my knitting mojo, which is proving quite difficult recently because A, there's about 9 million things I want / have to do for nursing school, and B, 800 yards is a lot. And I don't do sweaters. Like, I would not be able to finish a sweater in a month because the only sweater I've ever done has been a baby sweater, and that probably took me about a month. And that was nowhere near 800 yards. And it's not like I'm going to be ordering more yarn from the Loopy U. I am stuck with my lease weight. So, I don't know. I have to decide by the end of today, because I don't want to keep working on this if I'm just going to rip it out. So, I will definitely be doing this pattern eventually if I don't finish this one because it's a very nice pattern. I just don't know if I can commit to doing that. The idea of dropping out of the Plurt Podcaster Challenge has also crossed my mind because, and this is the only bit of negativity that's going to be allowed in this podcast, but I really don't see what the point of any of the challenges are if you don't have as many viewers as some of the other podcasts. I have 20 members in my Ravelry group. I don't have, over 500. So any of the, most knit-alongs, most bears, there's really no point to doing them at all that I can see. I like it in theory, but in practice, I don't know. I have not completely decided on that yet because I'm starting to seriously question what the point is. Anyways, okay, back to sunshine and happiness and everything, and forgetting the fact that this is the second time I've recorded. I'm deciding what to do with this, and I might just flip a coin or do like a random number generator to decide, because stockinette, I can totally do that in my breaks in class and when we're watching TV or whatever. So that may be happening. Kind of hope that it's not, but I think it might be happening. Yeah. That's pretty much all I have for knitting. I do have some stash enhancement. So in case I do keep going with the Firebird shawl, it calls for doing nups in chart C, which A, I've never done, and B, I don't really like the way it looks in the projects that I've seen that have done it. A lot of the other projects have called for putting beads in instead, which I like a lot better. So I got my first set of beads. I've never done beading before, but I've read enough how-tos online that I feel like I could totally do it. So these will either be in chart C of the Firebird shawl, or I will figure out a way to incorporate them if I do the stockinette shawl, like at the edges. I think that no matter what, this shawl is going to end up being my grandmother's Christmas present because she loves all things red. And for her, maybe the stockinette would make more sense because it would keep her warmer. Not that lace weight is really going to keep you that warm, but she's in California, so it doesn't really matter if it keeps her that warm. So that is all I have for knitting. Hopefully I get my knitting mojo back for the shawl. Whichever shawl I decide to do. I'm probably going to poke around patterns online and see, because some of the lace mortars might just be calling to me or whatever. And I can be sure to get 800 yards and not have to worry about fiddling with it at the end. So we shall see. I do actually really like that oaklet border that I did with the Sweet Allison shawl the other week. So something like that, because that called for a stockinette body with just the lace border. So maybe. I'll look around and see and look at other patterns because I haven't really decided. I just don't know if I can do lace knitting right now with classes and labs and everything. Yeah. So nursing school. I don't know if you can see, but this is my new schedule. All of the things in blue are classes. Oh, and I think you can't even see most of Fridays and Saturdays. Yeah, it's going to be completely insane, but it is totally worth it. I should keep reminding myself of that. Oh, other thing I forgot to mention for stash enhancement is I got a, silver fabric marker for labeling all of the 9 million items in my, in my lab kit, because all the blood pressure cuffs not only look exactly the same, they are exactly the same. So I don't want to lose mine. So I'll be having fun with the that marker. And I also, when I was finding the little button for my stethoscope cozy, I thought that on size 1 needles the buttonhole was going to be much smaller than it turned out to be. So I have 75 1/4-inch buttons. I have no idea what I'm going to do with them. It will be awesome, but I don't really know what I'm going to do with them. So if you have any suggestions, I would appreciate them. I don't know. I mean, they might be cute on like a little Henley or something, but then I would have to take the buttons off of my Henleys, and I don't know if I'm willing to do that. I think that's it for stash. Oh, of course it's not it for stash enhancement. My Yarnivore bags and t-shirt came, and I flip and love them, and I love Sadie, and she's awesome. And if you're not watching the Yarnivore podcast, you should. My Camp Loopy shawl is in my works in progress bag. A little Yarnivore on it. And I love them. The cats have been having all sorts of fun with the envelope because evidently they've never smelled Canada before. I'm just going with that's what they're smelling. Because they're not only smelling the outside, they're smelling the inside of the bag. So back to nursing school. It's a lot of labs these first couple weeks. We don't start clinical until, I think my orientation is August 31st, and then I don't start clinical, like actual clinical, until the week after that. So it's a lot of labs, getting ready and practicing skills that we're going to need for those. We did a run through of shift assessment, which is basically a shortened version of a full physical assessment that you do at the beginning and end of each shift, and anytime you're evaluating a nursing intervention, which an intervention is not only, intervention that you think about when you think drug intervention. It's any treatment, therapy, anything that you have done to the patient, and you're seeing if that has helped, hindered, not done anything. So you're basically going in, introducing yourself to the patient, checking what level of consciousness they're at. The patient, they had second and fourth semester nursing students acting as patients for us because they obviously know what we need to do for the assessments, and they would tell us if we missed anything. And we also had our professors hovering around watching the interactions. I know I got my picture taken I don't know where that picture is going. I don't think I'm gonna like it when I find out where that went. But it's just checking your patient, seeing, you know, where they're at, checking their different, their vital signs, different bodily functions, both, you know, cardiopulmonary, making sure they're, basically that all of their systems are working the way that they're supposed to. Obviously, before you would be doing a shift assessment, you would have looked at their chart, you would see what their baseline is, and be able to compare any things that may be different, for better or for worse, with that baseline, and see how anything's changed, if it has. My patient, I got the crazy one. So she was talking about seeing chickens in her room, and they had put a head bandage on her, so obviously she'd been in some kind of head trauma. But it was really entertaining. One of my professors happened to be watching while she was telling me about the chickens, and she told me that I had the best bedside manner of any, like, student she'd ever seen. And I think a large part of that is I essentially reacted the same way that I do whenever my grandma tells me about anything that happens on Fox News. Just sort of the, oh yeah, okay. You know, one of the things they're looking for is that you don't start laughing when a patient tells you that they're seeing chickens in their room. But at the same time, you're not playing into their fantasies, and you're not dismissing them, if that makes sense. There's 3 ways that you can go about it wrong. I don't really know how to describe what I do, but the 3 things that you really don't want to do are, you don't want to start laughing at your patient, because that will completely shut them down to you. Even if they are not entirely there, they will completely shut down if you start laughing at them. Unless they're obviously trying to make a joke. But if they're talking about chickens in their room, and they're not, like, cracking up a little bit, don't start laughing at them. One of the things you also want to avoid is playing into their fantasies, which, more applies to psych patients than trauma patients. But you don't want to encourage them thinking that something is there when it's clearly not. The third thing you don't want to do is just completely shut them down and or ignore them. You don't want to... You want to engage your patient while not playing into their delusions. It's difficult to really explain. You don't want to say, oh yeah, that's nice, and make it clear that you're not really paying attention to what they're saying, because your patient, especially when you're taking a history or doing an assessment, your patient needs to know that you're there to care for them and you're paying attention to them, and they're not just a number or something. That they are a patient and they are getting treated the way that they should. And I've sort of learned how to do that with my grandmother and Fox News. In essence, because I don't like raising my blood pressure if I don't have to. It's always a test once election season rolls around, which it already has. So sometimes I'm very glad that we don't have cable. Very, very glad. But yeah, I have, I actually have a couple fun stories about patients and delusions. One of which was my grandfather. A couple of years ago, right around the time that I discovered that I really wanted to be a nurse, my grandfather had a slip disc. And I think he went to the doctor on Wednesday, and they were going to schedule surgery for him for Monday, because it was the earliest they could get him in. He's like, okay, whatever. And he gave my grandfather, I think it was Percocet, for the pain, for the next 4 days, whatever. My grandfather he does have everything together, like he doesn't have dementia or Alzheimer's or anything like that. He is all there, but he does forget sometimes. And he may have forgotten that he was not supposed to take alcohol with his pain medication. He may have also forgotten that you're supposed to space out Percocet. At the very least, you want at least 4 hours in between dosage. I think his was supposed to be more like 8. My grandfather took a Percocet, drank about a half bottle of wine, took another Percocet, all within an hour of each other. Oh boy. I'm trying to remember, because I heard all this through a combination of the EMT people who had to come and get him and my grandmother, neither of whom were in my grandfather's head at the time. But evidently, my grandfather, this was before Barack Obama was elected. So George W. Bush was still the president. My grandfather thought that both President Bush's and President Clinton were at the back door trying to get in to talk to him about, like, urgent business. My grandfather was a plumber, so I don't really know what urgent business this could have been. But he was yelling and screaming at my grandmother because she was, quote, being a rude bitch and not letting the presidents inside. And he didn't understand why she couldn't, let such men of importance, she couldn't show them respect or something. It took him about somewhere between 24 and 48 hours to fully come down from that. So I was there after the EMT personnel came, and they took him to the same hospital where he was going to have his disc surgery. And I was out of school for the summer at the time, and I don't think I had started working yet. But I was with my grandfather at the hospital. And as I said, my grandfather's a plumber. He still works. And the hospital that he was at 30 years ago, when the hospital was first being built, he did the plumbing for the hospital. And since he was still under the effects of the Percocet, he was sure, dead sure, that he was at the hospital on a job to fix the plumbing. My husband, who was my fiance at the time, had worked for my mother, who also has a plumbing company. And so I guess whenever my grandfather would see Will, he thought that he was there to help him for the job. And so he was getting very frustrated that Will was not getting him the ladder that he kept telling him to get. Which was rather unfortunate, because eventually he did regain his mental faculties. I spent a good day reassuring him that no, he was not going crazy, he just needed to not take his medication at the same time. They did scans, everything was fine, there was no permanent brain damage or anything. But it really didn't help his case afterwards, because then whenever he would complain about something, and it was a legitimate complaint, the nurses would ignore him because they thought he was crazy. No, he wasn't crazy. There actually was a problem with his toilet at the hospital. The flow rate was way too high, and so it basically, when you would flush the toilet, it would give you a shower. Yeah, I grew up with a family of lawyers and plumbers, so I know way too much about both of those professions. So, long and short of it is, if you're going into nursing, know what not to do so you can be sure not to do that. Yeah, and I am loving nursing school. I'm very much enjoying it. I am getting my first validation a week from yesterday, so on Friday. This is the sheet that I have. It's the same sheet that they'll be grading me on. Grading. I don't think the entire class is pass-fail because there are actual exams at certain points. But as far as the hands-on portion, I think it's pass-fail. So you get three attempts for each validation for critical behaviors. The first of which is hand hygiene and vital signs. So I know you can't read them, but each of these things is a different criteria that you have to meet. So there's yes and no boxes and comments. It's all little things. The ones in bold are, if you miss these, you automatically fail. And then I think you can miss one or two of the not critical parts and still pass. Because half of this page are the individual criteria for hand hygiene, which is extraordinarily important. But most of these are really no-brainers. Like discarding your paper towel in the proper trash receptacle instead of leaving it on the sink, I guess. A lot of it is important. Some of it, if you don't know how to do this, I don't really know how you pass kindergarten. Anyways, there's also blood pressure and pulse/respirations, which is breathing rate, pulse rate, and your blood pressure. And for blood pressure, you need to be within 4 millimeters of mercury of the accurate blood pressure. And since you're validating on a real person and not some of the mannequins that we've used to practice, they have double-headed? They call them double-headed, but that would imply that there are two heads. I don't know. It's one head to two sets of earpieces. So you have one set, your professor has the other, so you're listening to the same sounds and you're looking at the same blood pressure cuff for the pressure valve. And so you and your professor take the blood pressure at the same time, and each of your numbers has to be within 4 millimeters of mercury to her findings. And then pulse and breathing rate have to be within 2 either beats or breaths per minute. Excuse me. I don't know why I'm tired now. I only woke up once last night. I'm highly impressed with myself. I think it's because I went back to sleep when I was supposed to wake up. It's the weekend. And that's really it for nursing school. I will probably talk more about my study habits a little bit later. Needless to say, I think I finished going over things for this past week, and I just need to get a head start on the lectures for this week. I might talk about that next week, because I know I won't have that shawl finished, so I'll have something to talk about. And, you know, whether or not I pass my validation, which I will. You get 3 attempts to do it, and during practice yesterday, I wasn't even off by any amount for blood pressure or for respirations or pulse. I was dead on. And that was on a real person. I've been dead on with the mannequins, but mannequins tend to be easier to hear than people. It's not easy, but it's something that you need to be able to do to be an effective nurse. So I am hoping that everything works out with that. I'll be doing a lot of practicing on my hubby for that and on my partner doing open lab. So yeah, that's about it. If you haven't already joined the Ravelry group, if you're watching this on iTunes, feel free to leave a star rating or a comment, and you can check out the show notes at notableneedlework.blogspot.com. And I will be here next week, and I will be asking you for yarn selections for my Plurk Podcaster Challenge assignment, for lack of a better word. I hope your week is going well, and I think it's starting to cool off here a little bit, which I'm very excited. It's only supposed to be highs of upper 80s next week instead of, you know, hundreds. So very happy about that. I'm hoping it cools down significantly before I have to wear my scrubs full time. So yeah, have a good week, and I will see you later.